Today we'll be exploring the comprehensive treatment options, post-op care, and the crucial role of parental support in the journey to a healthier heart for your child. Hello everyone, I'm Dr. Rohit Arora, Director and Head of Neonatology and Pediatrics at Cloudnine Hospital, Gurugram. Welcome to our discussion today on congenital heart defects. Today we'll be exploring the comprehensive treatment options, post-op care, and the crucial role of parental support in the journey to a healthier heart for your child. Now, did you know that congenital heart defects affect approximately 1% of all live births globally? Which means that out of every 100 babies that are born, one baby will have some or the other congenital heart defect. The diagnosis of these disorders is typically made either before the baby is born through the antenatal ultrasound scan or after the baby is born through clinical examination, which suggests that baby is looking blue or that there is some abnormal sound in the heart that is heard during the child's examination, and then an echocardiogram is required. Now, there are many different types of congenital heart defects. Some are commonly called as the hole in the heart. You must have heard that your doctors are talking about, which simply means that there is an abnormal connection between the two sides of the heart, the left and the right. So that's why it's called as a hole in the heart. But there are other types of heart defects as well. Some of them include that there is some abnormality with the valve of the heart. Then there could be a block to the blood flow that's entering or leaving the heart. Then there can be the connections of the blood vessels which are abnormal. And then some part of the heart can be too small to work properly. So these are some other variants of heart defects in the kids. Now, sometimes a child can be born with more than one congenital heart defect, right? Or it could be a part of a syndrome wherein there is defect in other body organs as well alongside the congenital heart defects. So such as there can be problems with kidneys, there can be problems with liver or the brain. So they are combined together. And then there is simultaneously a heart defect as well. The diagnosis of congenital heart defect can be very challenging for the families, right? However, with advancements in medical science, we now have a range of treatment options available tailored to each unique case, and the outcomes have been steadily improving as well. So the number of cases which are diagnosed, thankfully 75% of these babies who are diagnosed to be having congenital heart defect will not need any treatment at all, and these defects usually autocorrect on their own without needing any intervention. Only 1 in 4 cases which are diagnosed to be having some or the other congenital defect will need either medical management or some amount of surgical treatment correction is required. Generally, one surgery suffices for the treatment, and that usually lasts for the whole life. Sometimes very complex defects might need more than one surgery, and they are also usually finished by the time the child is 3 years old. The outcome of these surgeries are quite good these days, right? As I mentioned, studies actually indicate that approximately 85% of children who undergo corrective surgeries go on to lead healthy lives well into the adulthood. A very small percentage of such babies actually require a follow-up surgery in adulthood. Due to the nature of the growth of the person in adults, the heart grows, the person grows, so they might need another surgery when they become adults or due to certain unforeseen developments. Now, kids treated for these defects, either surgically or medically, will need regular visits with a pediatric cardiologist. So once the treatment is given and the surgery is done, they would still need regular follow-ups as required. So initially, these visits might happen often, let's say once or twice in a month also, but later as they grow, as the time elapses, the visits are reduced and they can be as less as once in a year kind of visits. The cardiologist during the visits might ask to, X-rays might be ordered, ECGs or even echocardiograms might be done during the follow-up visits, and then they are required for the follow-up of the treatments. These regular checkups help us ensure that the child's heart is functioning optimally, and if there is any potential issue, they can be addressed promptly. With proper care and timely intervention, children with congenital heart defects can lead a very fulfilling lives. However, it's very crucial to adhere to the prescribed medications, exercise caution, and maintain a healthy lifestyle to ensure continued well-being. Please remember, you are not alone in this journey, and a comprehensive care and support is available, not just for your child, but for the entire family. So just to summarize, heart diseases are very common issues which happen when the babies are born. But thankfully, these days, the comprehensive treatment is available, and most of the heart diseases are correctable. And with proper follow-ups, kids lead a very fulfilling lives as well. For any issues, you can always connect to your pediatricians. Thank you and bye for now.